Okay, let's unpack this. There's this really striking statistic right here in the material we're looking at today. Thyroid disorders affect roughly 1 in 10 Americans. Just, think about that for a second. That's a lot of patients who are likely sitting in your dental chair probably every single week.
It really is. And that's exactly why we wanted to do this deep dive using the sources you sent over. We're focusing specifically on that crucial intersection between these common thyroid conditions, the medications people take for them, and how it all actually impacts dental care.
Right. Our mission here is basically to go through these excerpts written by dental and pharmacy experts.
Right.
And really pull out the most important stuff, the, actionable insights, the practical takeaways you really need day to day.
Exactly. We'll cover why understanding this is so vital for you, look at specific meds and their sort of dental watch points. We'll also talk about safety with anesthesia and highlight some key drug interactions that the material flags.
So why is this intersection with dentistry so, profound? The sources are pretty clear that thyroid hormones have this huge systemic influence, right? Affecting energy, metabolism.
Yeah, everything. And that ripple effect, as they put it, it extends directly into oral health and critically into dental safety.
Makes sense. So whether a patient is managing hypothyroidism, maybe they're on levothyroxine, or dealing with hyperthyroidism using something like metamizole or propylthiouracil, the material points out these meds can really significantly impact how you plan and deliver dental treatment.
Absolutely. The areas specifically called out as potentially affected, things like bleeding risk, how fast someone heals, how different drugs might interact, and even how a patient might respond to your local anesthetic.
And this is where the sources really kind of hammer home the point. Staying informed isn't just about being thorough, checking a box on the health history. It's genuinely about preventing adverse outcomes for your patients.
Right. Getting that detailed medical history, including the specific thyroid meds someone's taking and understanding what they do, it's presented as just absolutely essential practice.
Okay, so let's dig into some of these common medications then, and the specific dental watch points the sources are highlighting.
Sounds good. First up, for hypothyroidism.
Yeah.
We're looking at levothyroxine. You probably know it as Synthroid, maybe Levoxyl. The material notes this is one of the most commonly prescribed medications in the entire U.S.
Wow. Okay, so super common. Is it generally safe for dental stuff?
Yeah, the general consensus from the sources is that it usually is safe for dental procedures, but they immediately raise two critical watch points you really need to be aware of. First, xerostomia, dry mouth, which, directly translates to an increased risk for caries.
Right, classic connection there. What's the second one?
The second one, and this is crucial, is hypertension as a dental side effect. They strongly recommend checking blood pressure preoperatively for these patients.
Okay, that levothyroxine hypertension link, that's a really critical one to remember chairside. Definitely.
Absolutely. And there's a great clinical tip in the source material here, too. If you happen to observe signs that might suggest poor thyroid control, things like unexplained fatigue, really dry skin, maybe noticeably slowed healing, it's really worth considering just a quick collaboration, maybe a call, with the patient's primary care provider, because those symptoms can definitely impact how well they recover from any invasive dental work you might do. Good point. Okay, so that covers the hypothyroid side, primarily levothyroxine. What about hyperthyroidism medications?
Right, good question. Let's look at methimazole, brand name Tapazole. It's used to manage an overactive thyroid, or sometimes to prep someone for thyroid surgery. The key thing the sources emphasize here is that this medication works by suppressing immune function.
Okay, suppressing immune function. That immediately throws up a bit of a red flag for me, thinking about the dental chair. What specifically do the sources say we need to watch out for with methimazole patients, especially thinking about infection or healing? Yeah, and this is where it gets really serious, actually, and needs your sharpest clinical eye. If a patient on methimazole shows up with symptoms you might normally dismiss as minor, like, say, unexplained mouth sores, or gingivitis that seems way out of proportion, maybe flu-like symptoms, even painful swallowing.
Okay.
The sources give a very strong warning. Do not just assume it's viral or something unrelated.
And why not? What's the big worry there?
Because those symptoms could signal a rare but really severe adverse effect called granulocytosis. That's a dangerous drop in white blood cells.
Oh, wow.
Yeah. So the recommendation from the sources is crystal clear, non-negotiable. Prompt referral to their physician. Don't wait. They also list other oral side effects to watch for with methimazole, things like gingival inflammation, maybe loss of taste, salivary gland swelling, sialadenitis, and an increased risk of bleeding too.
Okay, that agranulocytosis warning is definitely something to keep front and center when you see methimazole on a health history. All right, we've covered methimazole. What about the other one mentioned, propylthiouracil or PTU? The sources say it's less common.
Right, less common. But if methimazole has watch points, PTU comes with an even bigger red flag. The material immediately jumps to its black box warning for potentially life-threatening liver toxicity.
A black box warning for liver toxicity. Wow. Okay, that sounds incredibly significant for dental prescribing. What's the direct implication there? For dental treatment, I mean.
This is crucial. Because of that compounded liver risk, the sources specifically advise avoiding acetaminophen Tylenol or any combination pain relievers that contain acetaminophen if your patient is taking PTU. It's a direct contraindication, or at least needs extreme caution, and definitely talking to their doctor first.
That is a critical piece of information that could so easily be overlooked. What other watch points should we be aware of with PTU, according to these sources?
Keep an eye out for taste changes, or even loss of taste, and salivary gland enlargement. And echoing that methimazole warning, the sources reiterate the absolute need for physician referral if you see signs of severe infection. The mouth sores, pain swallowing, gingivitis, fever, flu symptoms, chills, all that. Prolonged bleeding is also listed as a potential issue with PTU.
Okay, so knowing all these medication specifics is really key. Let's address a common question that actually comes up in the material. Is anesthesia with epinephrine risky for patients with thyroid conditions?
Yeah, and the sources give a nuanced answer, but it's pretty clear. For patients with well-managed thyroid conditions, meaning their hormone levels are stable, they're controlled by their medication, using local anesthetics with epinephrine is generally considered safe.
Okay, so well-managed is the operative phrase there. What's the actual risk factor then?
Exactly. The significant risk factor is uncontrolled hyperthyroidism. In those patients, giving epinephrine can dramatically increase the risk of adverse cardiovascular reactions. We're talking severe tachycardia-like, really rapid heart rate, and dangerous hypertension.
Right. So if you're in doubt about their thyroid status, maybe the history isn't clear, or if you know a patient has uncontrolled hyperthyroidism, what's the recommended approach from the sources regarding anesthesia choice?
Their guidance is basically to err on the side of caution. Opt for a local anesthetic without epinephrine, or if you feel some vasoconstriction is absolutely necessary, use a lower concentration. And they strongly reinforce confirming the patient's current thyroid status before any procedure and diligently monitoring their vital signs before, during the whole thing.
Makes sense. Now, beyond anesthesia, the sources also highlight some specific drug interactions that we, as dental professionals, really need to be aware of.
Yes, there are a couple that definitely stand out in the readings. One notable one is between levothyroxine, the hypomed, and carbamazepine. Carbamazepine is often used for things like trigeminal neuralgia, which we certainly see in dentistry.
Right, and what happens when you combine those two?
Well, the sources explain that carbamazepine can actually increase the metabolism of levothyroxine. So it basically speeds up how the body breaks down the thyroid hormone. This could potentially leave the patient functionally undertreated for their hypothyroidism, which could then lead back to those signs of poor control we talked about earlier, fatigue, healing issues.
Yeah, that's definitely not an interaction you'd immediately think of unless you were specifically looking for it.
Exactly. And they also stress caution when combining antithyroid medications, especially PTU, with NSAIDs or acetaminophen. We already get the compounded liver risk hard with PTU and acetaminophen. But the material also raises a more general caution with NSA-thetas in patients on antithyroid drugs, often related to potential bleeding risk or maybe impact on kidney function, which can sometimes be compromised in severe thyroid disease.
So the overall guidance here really just boils down to always thoroughly review the patient's complete medical history and their medication list. And when there's any doubt or complexity, pick up the phone and consult their physician.
Absolutely. Pulling this all together, the final thought section from the source material provides a really powerful synthesis, I think.
Yeah, they make it so clear that looking at a patient's thyroid meds is just so much more than noting another line item on their health history form. These medications have very real, concrete implications for how that patient might tolerate anesthesia, their post-op healing, their risk of bleeding, and even which pain relievers are actually safe for you to recommend or prescribe.
Right. So when you step back from all the individual details, the real aha moment the sources give us is this. Every single fact we've discussed, from, dry mouth with levo to liver warnings with PTU to the epinephrine risks and uncontrolled hyperthyroidism, that isn't just information. It's a direct prompt to actually change how you assess and plan treatment for these patients. It shifts them from just general medical history to a parent population needing specific, informed protocols right there in your chair.
And the sources really emphasize that simple steps can make a huge difference, can't they? Like a quick but thorough med review, adding that extra BP check before a procedure, maybe using chairside resources like the digital drug handbooks mentioned in the articles. These aren't meant to be burdens. They're presented as essential tools that really enhance patient safety and treatment success for this very common group of patients.
So what does this all mean for you, listening? Understanding the specific implications of these common thyroid medications isn't just, good to know. It's presented as absolutely vital for providing truly safe and effective dental care to a really large segment of your patient population.
Definitely. So here's a final thought for you to mull over based on this deep dive into the sources. Given how incredibly common thyroid conditions are and the very specific, sometimes high-stakes risks and interactions we've highlighted from this material, how does reviewing a patient's health history, specifically for thyroid medication, truly change your clinical decision-making process right from the moment they sit in your chair? What systems or habits in your practice could maybe be enhanced by this knowledge to make sure you're catching these critical watch points every single time?